Ever wondered how a ventilator keeps someone alive when they're not able to breathe? There is a myth going on, or a wrong or a misconception about ventilators. When a patient comes to the ICU and when he is put on the ventilator, it is a death sentence. But that is completely wrong. If you look at the statistics or what is happening right now in our present day ICUs, every 10 patients who goes on ventilator, 8 patients do come out of the ventilator. It is saving a lot of lives. And ventilators are usually put when the patient's lungs are affected or so many other reasons. It helps us to provide oxygen and also to remove carbon dioxide. So how do we put somebody on ventilator? We usually pass a tube called as an endotracheal tube into the windpipe, which is also called as trachea. And this tube is connected to the ventilator. And this ventilator helps us to breathe better. And whenever we pass the tube, we usually give sedation to these patients, and they'll have some pain relief also. So they won't even know how the tube is going into the windpipe. And also whenever the patient is on ventilator, we usually give them some medication so that there won't be much of a discomfort. And how long do they stay on ventilator? It depends upon the patient's condition. There are certain conditions where the patients have come out of ventilator in a day or two. Some patients will require longer runs. Some of the common conditions where you put somebody on ventilator is whenever the lung is severely affected because of pneumonias. Sometimes cardiac dysfunction can cause lung dysfunction because of the fluid filling in the lungs. That time, for temporary support, we put them on ventilator. In a stroke patient or any other causes where the conscious level of the patient is down, there also ventilator is required. We also use a different mode of ventilator called as non-invasive mode of ventilation, where the patient is not very sick. So ventilation helps. It actually bridges a gap between the critical illness and the recovery. Every breath is important, and ventilator helps us to get there and help a lot of patients.